shaking, couldn't breathe, had never experienced anything quite like it before. And so I knew I was in trouble, and I woke my wife up, woke Sharon up, and said, hey, we got to go to the hospital. And I can remember going out and getting in the car and waiting for her to come.
Pulled in right in front of the doors, got him out. I remember him telling the nurse, you know, he didn't feel well. So I had to move my car. And by the time I came back in and went to the cubicle where he was, there's this young man standing on a bench on CPR, and
when your life comes to a grinding halt, you're surrounded by strangers, the outcome's uncertain. I don't know how much more of a catastrophe it could be.
And it really was kind of a terrifying thing because the pain got so intense. You know, it takes something strange to get you to make the decision, I'm gonna go to the emergency room now.
So I guess my first feelings when I got there was that of fear and just being totally overwhelmed.
You're scared, and so anything anybody can do to alleviate that. For me, it was information. If the more information I had, the better, so talk to me.
I think it's important. I think it's important that you're confident in where you're going, that you have confidence in the people that are going to take care of you.
Nobody wants to turn their body over to anyone that they don't trust. It's hard to trust a stranger, whether they've got a lab coat on or a medical degree or whatever.
It's not a place where you hope to be, but if you have to have a stay at the hospital, you hope for kindness and sincerity and attention to detail. It's nice if people remember your name. The right kind of people saying the right kind of things sure can help.
Little things, a genuine hi, how you doing today?
We don't want to lose, as we get bigger and more efficient, the humanistic side.
I expect to be treated with kindness, dignity, and I would like clear communication. Sometimes I feel that information is withheld at times, and I would like to have that information as soon as it's available.
Well, you're in there for a reason, and you want to know as soon as you can what's going on and what's the next step. So I think waiting is probably the most frustrating thing.
I want to know. It's my life. I want to be able to make good decisions based on the information I have. So it's important to me as a patient that I get my questions answered.
You hate to kind of fade into the fabric of where you're at and become just a number or just a stop along the way.